Pain relief specialists are constantly researching new ideas to reduce or even eliminate pain. Many people have found excellent results with a procedure that actually eliminates the nerve endings that sense the pain. Dr. Jay Lasner from the Anesthesia Pain Care Consultants is here to explain. Good morning.
Good morning. Thank you very much for having me this morning.
Yes, I see you brought Mary Kate Olson with you today to demonstrate how this can actually work on your back. Now, there are so many people who suffer from back problems, and they tell me that is the worst pain ever. Tell us what this machine is and what it does and how it works.
Sure. This is a radio frequency generator. Basically, this is one of the many ways we at Anesthesia Pain Care Consultants use to eliminate pain, in this case back pain. Simply put, we use radio waves to eliminate the pain. Much as the station is putting out high-frequency waves to transmit their signal,
right,
we've harnessed that signal in this box, and it's a radio frequency generator,
right,
and that signal then goes into this probe, and we actually target specific nerves in the back to eliminate pain. What we do is we block the transmission. As you mentioned, we block the transmission of the pain by targeting those nerves. Now, initially it was said that this was a non-invasive procedure. The reality is this is a minimally invasive procedure.
Because there's a needle involved.
There is a needle involved. It's a small needle, and patients are sedated for the procedure so that they're comfortable.
But doctor, I will tell you right off the bat, when you tell a lot of people, and specifically when you show that needle, people are very, very, and obviously because we're talking about the spinal cord here, very concerned about anything going into their back. What type of back pain specifically is this for?
Sure, there are a couple of different types of back pain. One is for arthritis in the back.
Okay.
If we can pan on the skeleton, these are joints in the back, and those joints become arthritic. Essentially, what we can do is target the nerves very specifically under fluoroscopic guidance. My partner and I were among the physicians that pioneered the use of fluoroscopy or live X-ray to specifically target areas of the body, in this case the spine, to very precisely place injections.
So what you're saying is when the radio waves go through the needle, that vibration actually overpowers the pains going into the nerves?
Actually, what we do is we either heat the nerves or apply an electrical current to those nerves, and it changes the structure of the nerve and gives long-lasting relief.
That's what I was going to ask you. How long does it last?
Typically at least a year. And often the pain does not recur. If it does recur, we can retreat. Again, it's a minimally invasive, it's not uncomfortable. Patients may be sore for a week, nothing that's incapacitating. They can go about their lives, and after about a week, the pain should be gone, and hopefully for at least a year. Right. Now, it's very important to know that it requires a lot of training for this. The physicians and anesthesia pain care consultants have been trained by pretty much the experts in the world at this procedure.
Okay.
And we actually now have been called upon to train other people in the United States and around the world in this procedure.
How about that? And you're right in our own backyard. Does
Yes.
insurance cover something like this?
Yes, insurance covers this. It's not experimental. It actually has been around for a number of years, but through technology has been perfected, and as the technology becomes more perfected, we can give longer and longer relief. But again, it's important to know that it's very physician or operator dependent.
Right.
The more experience, we have a lot of experience with this procedure, and the more experience the physician, the better the outcomes.
Okay, so if people want to get in touch with you and ask some questions, how do they do so?
954-720-3188, Anesthesia Pain Care Consultants.
Wow. Well, you know what? You're helping a lot of people. You got to feel good about that, huh?
It's a great pleasure.
Good. Okay, Doc. I know a lot of people will be calling you and see if this can help them. Thank you so much for coming and bringing your handsome model.
Thank you for allowing me to help your viewers.
You're welcome.